Let's call the meeting to order at 7 o'clock. And Michelle, if you could do a roll call.
Sure. Strassman,
Here.
Hilla,
Present.
Roberts,
Here.
Cronin,
Present.
Johnson, Miller, Lonsdorf,
Here.
Schnapp,
Here.
Lugenbull, Anderson,
Here.
and Dostalek.
Present.
Okay.
So we have a quorum. Was there any public comment?
I just checked as of half an hour ago. Nope, I got nothing.
Okay, let's go ahead then for review and approval of the meeting minutes from January 20th. Everybody get a chance to pursue the minutes? Any comments? If not, a motion to approve.
I'll move approval, Lancer.
And there was a second, I guess. JR, you second?
Sure, second.
Okay, all in favor, signify saying aye.
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 Anyone opposed? Hearing none, the minutes from January 20th are approved as submitted. We'll move on to the chief's report. Patrick, it's all yours.
Thank you. So I emailed this out, so you were to see that. So this is our first new change the color for a new year, so it's not confused. But it was a pretty busy, as you can see there, pretty busy January again.
Can you share it or not?
Oh, I'm sorry. Yep, I usually do that before we even get started. Stand by.
Okay.
Thank you, Jeff.
I was like, it's not busy because there's nothing on.
There we go. That's what
There
it
we go.
usually. So good thing I was changing all those screens for you guys not to see it earlier. Let me just wide it up so you can see some faces in case you have any questions. So there we go. There's the chief report that did get emailed out to you. So it was another busy month last month, kind of just continuing on with the where we were at last year. Not that, the nature of the job that we do this month has been much, I'm going to say, less active. So I think maybe back kind of down on the curve again to see back to some normal stuff. There it is. Otherwise, nothing out of the ordinary. A little bit more calls in Fitchburg than normally. But otherwise, all the rest of the calls we had, fitting within the normal stuff that we report. We actually just had our last training with our consortium, was trauma in pregnancies and abnormal childbirths. And then we're working with our fire crews this month to do our high performance CPR stuff, which essentially is integrating the fire department into us, into just kind of doing this team dynamics resuscitation thing. It's a very formal program, but that's kind of been our task for the month. Are back teaching some CPR classes. Had one last December, and then had a couple more for the community, smaller classes, posting at the fire station, and then we'll work with the PD next month. It's the first month back the new year, so we're not going to see a ton of stuff as far as our median, but there's our usuals, graphs and charts. As far as our financials go, everything looks right where it should be. We're at our 30 day and the 30 to 60 day because we're coming off of a couple pretty big months. But otherwise, those are within normal. I am seeing, I don't have what those numbers are in front of me. I don't know if it's just coincidence, kind of what's going on with the economy or anything, but I have seen a pretty significant number of hardship requests over the last month. Still not a huge amount, but the number of them coming through is kind of risen up a little bit. So in the next couple of months, I can try to put something together as we approved the hardship policy or procedure there a few months ago. I can bring that to you and you can kind of see what that looks like. Again, it's not a huge impact in a couple of zero budget there, but where I am starting to see some more requests for hardships come through. As far as our cash on hand, that's where we ended up at the end of January. We did get both of our checks from the city of Fitchburg, city of Verona. For whatever reason, the one for the town of Verona, it was addressed to us, but the post office delivered it to Miller's. So they finally actually did get it to us. So you're not going to see it posted in here, but it was actually, we did get it. big difference we see in the savings there is because we usually get our Epic dollars at the end of the year and we spend them not till the purchase of the next year. So that's why you'll see that pretty big decrease from last year to this year. Next month, you will see the ambulance CD, as we had talked a couple months ago. That did come due at the beginning of February. So next month, you'll see that actually come off of that. That is cashed and actually did get put into our account here for use in the next ambulance or to help bring that reserve back up. And then nothing crazy with our retirement accounts. And we'll see that interest come up at the end of the year. No donations from anyone for the month of January, and February was not a good month to hire anybody, so I didn't have any milestones there. So here's our first month as far as expenditures go. We are a little under as far as expected run income, but that tends to happen the first part of the year as just kind of the last part of December, things get closed out and don't necessarily get processed for a couple of days with holidays, but it's 0.5% underneath. Explained already about where our municipal funds are. Otherwise, it's there for you to take a look at. There's some highs and lows in there. Essentially, some of those things are explaining. You'll see like 25% of a line item is spent already, but those are things that we pay like quarterly or one big chunk the first part of the year, one big chunk the second part of the year. So I think there's another one on there that's like 50% of that was already spent. That's because we do 2 payments out of the year. So if you look at big picture stuff, I scroll all the way down, this was sent to you. Total expenditures for the year, we are at 8.4%. And if I look at the top, we're at 8.5% through the year. So for 1 month out of the year, we're actually spot on where we should be for the rest of the year. Any questions on the financials or the report, my chief report? So that's all I have for the chief's report. Jeff is always more than willing to join us, but I did actually ask him to hop on and talk with us, to share with you tonight. I don't know if you saw the blast through social media or if you follow Fitch-Rona. We are enrolled in we're accepted into a study to share information about the use of lights and sirens in emergency services. And so if Jeff, you got something to share there, I was going to have Jeff talk to you a little bit about it just because I know it's out there in the media.
Sure. So we were fortunate enough to be part of the study that includes a total of 50 EMS agencies from around the country. And the idea behind the study is to try and reduce the number of crashes and injuries in EMS providers and the general public with it's ambulances and fire trucks, but in our case, ambulances, try to reduce the number of injuries and accidents around the country as a result of using lights and sirens. So the study is going to be a year long. The people that have commissioned the study, the National Association of EMS Quality Assurance, NEMSQ, the core group in that organization are EMS leaders from around the country, people that have been in EMS for a really long time, including Dr. Clausen, who wrote the Priority Medical Dispatch EMD protocols that almost every agency or most agencies in the country use. So as part of the study, we submit our data to them. We were able to submit a whole year's worth of our responses of lights and sirens, both responding to calls and transporting to the hospital. And then over the course of the year, each of the agencies is to come up with some ideas on how to reduce the number of emergency responses, how to reduce the number of emergency transports to the hospital. For example, for us, this first go around, we are educating our staff on the use of lights and sirens. We have a standard operating guideline that outlines how we should respond to, alpha calls or Bravo calls or the higher acuity calls like Echo and Delta calls. And then the same with transports to the hospital. And so, while I think most of our staff knows that we have a standard operating guideline, I don't know that they actually follow it. So we're educating the staff on the use of how they should be responding to those calls. And then we're just tracking to see if that improves our numbers. So right now, just off the top of my head, we're Responding to calls, we're at about 58 to 60% of the time. We do not use lights and sirens. The goal for the study is 70% of the time not using lights and sirens. And then for transporting to the hospital, we're about 88, 90% of the time where we don't respond to the hospital using lights and sirens. And the goal is 95% of the time not using lights and sirens. So for that metric alone, we're doing a pretty decent job. For the other metric, we're probably right in the norm of where everyone else is. But there are organizations throughout the country that on almost all of their calls, they don't respond lights and sirens at all, just because of the sheer volume that they have. Like I used the example Mecklenburg, Charlotte, North Carolina area. You know, they have different protocols in place for ordering Ubers for the low acuity calls to dispatching the closest ambulance. So it's going to take, a couple of different ideas to try and help, reduce our emergency responses. Educating staff is the first one. The second one will be doing a public blast about the study, which we're talking about it now. We'll do some media stuff out there. I think Fact TV covered our Facebook post, because there is a public perception that if we don't respond lights and sirens to a call, then people are like, well, you weren't hurrying to get to my emergency. And in fact, they've proven that it only saves anywhere between 48 seconds and 2.5 minutes on average of time. And really, the amount of risk that we put towards the public and to our staff and to the patients in the back of the ambulance is much greater than that 48 seconds. So it's a mindset change for emergency responders. It's an educational thing for the general public. And then we'll take a look and see what other agencies are doing around the country to see if we can adopt some of their methods as well to help reduce our use of lights and sirens. So I'm really excited. I think we're very fortunate to be part of the 50 services, anywhere from Deer Grove is part of it, all the way up to big services throughout the country that do 50, 60,000 ambulance runs a year. So and then at the end of the year, at the end of December, then the group, the 50 of us, will put together a position paper and a study that hopefully will be published. So that's where we're at. Any questions?
Yeah, Jeff, I have a question. Isn't use of lights and sirens supposed to be a safety feature? You're making it sound like when you put them on, it's less safe.
It is considerably less safe to use lights and sirens on emergency responses. So in our response policy, I'll just throw the dispatch code numbers. So an Omega level is the lowest acuity call you can have. Alpha would be the second, Bravo, Charlie, Delta, and Echo. Our response guidelines state that anything that is an Omega level or an Alpha level call is a non-emergent response. And that's determined by the 911 center when they ask questions of the caller on what types of responses are out there. Obviously, Echoes and Delta calls are higher acuity calls, and those should generate an emergency response. But running red lights and sirens does, there's so many things that go on psychologically with the providers that are driving the ambulance. To obviously, you've seen the videos of cars doing silly things. It's established that we operate with due regard and go through red lights, but that doesn't mean that people pay attention. And so there is a considerable risk. We're fortunate. I will knock on wood. We haven't had, there's a line in the study that says accidents and injuries as a result of this week of responding. And I have been fortunate enough to say zeros across the board because we don't have any of those, but around the country, it is a prevalent problem. So it's way more dangerous to respond lights and sirens.
All right. And it sounds like it only saves under a minute on an average run.
Yeah, 48 seconds to 2.5 minutes on a 90 percentile of calls responding non-emergent. So we're not saving an awful lot of time. And we've had our providers and have said, well, if that's your loved one, 2.5 minutes is a big difference. And we talked about that in the study, and there's really no proven, there's nothing proven to say that 2.5 minutes actually made a difference or dent. It's too short of a time period. But the amount of risk that we would put ourselves in public in to get there is much greater. And I think part of the study should include, like in those echo and those deltas or those high acuity calls, it's public education on early access defibrillation. It's public education on bystander CPR. So if somebody says, well, you didn't come lights and sirens on our echo call, well, we should have. I don't think any of our crews would ever not respond emergent on those types of calls. But if the general public can, that it's coded wrong, for example, and it gets coded as a Bravo and our crews don't respond red lights and sirens, and they get there and somebody's in cardiac arrest, well, we're hoping that somebody's done CPR, early access defibrillation, or they just gave wrong information to the dispatcher. So it's a process. When I looked at our past numbers, there's those Alpha and Bravo calls. We have responded more emergent than I thought we did, but we're trying to change the way our putting safety in front of some of those calls as well.
Did the lights and sirens system of having that for ambulances, that must have evolved well before the modern capabilities of ambulances. If you look at movies from 20 or 30 years ago, ambulances were basically just stretcher bearers, and they would, run as fast as they could to the hospital.
Right.
Now, like you're saying, there's all sorts of other therapeutics that the ambulance can do that makes it a lot, maybe less necessary to drive, 90 miles an hour or something.
Right. And some of the agencies that, I don't remember which one was mentioned as part of the study, but that agency, a big metropolitan agency, has not responded to the hospital red lights and siren in years. Even on cardiac arrests, they are able to take care of those patients just as efficiently in the back of the ambulance as they are in the ER. And the risk, and we actually talked about it with a couple of people, one of our crews today, is it really worth driving, all up 18151 from Verona to the hospital doing CPR in the back and all of the stuff that we have to do when in fact we get to the hospital and they can do the exact same thing that we're able to do. Where I think it would save a lot of time is obviously that penetrating trauma or that trauma call or that head injury where we might have to have surgery right away. But as of now, I don't think we're at the point to say to our crews, if somebody's in cardiac arrest in the back of the ambulance, don't run red lights and sirens to the hospital. But there are some services around the country that don't run red lights and sirens to the hospital because it's much safer, even in that high acuity call, than it is, driving crazy on the highway.
Is there a reasonable movement to just do away with lights and sirens in the region or in the country?
I don't know that, doing away with it altogether, but, that's, I think one of the reasons why we're doing this study is to see how prevalent the issue is. And, these agencies that are involved in it, are big agencies. So they drive a lot of the stuff that we do, the care that we do in the ambulance, the equipment that's out there from big providers. I don't know if we'll ever get away with, all together, but I don't know. We'll see. We'll see what the study actually shows. And that's the reason why we're doing it. We need to reduce those injuries and those accidents.
It's very interesting. Thanks.
Yeah, the city, just besides Fitch-Rona, Deer Grove, the city of Monona, and the city of Madison are all participating in this study. And the city being the biggest provider in the area, I'm really glad that Chief Carbon was able to get their name in there and participate in something regionally here in Dane County with us. So it'll be fun to watch how that. I can look at JR and know how fun that's going to be to watch that culture change, because it'll be a big culture change for some people. And we'll work with the fire department. I know I'm talking a lot. Sorry, Patrick. We'll work. I've reached out to Fitch-Rona Fire and Fitchburg Fire, and I have a meeting with the City of Fitchburg Fire Department next week with Chad to talk about the culture change in the fire service as well. And the reason why I think it's important that we look at this holistically as emergency responders is that when our crew decides not to go red lights and sirens to the traffic crash where there's really no injuries, and the fire trucks go flying by us, red lights and sirens to the same traffic crash, the public goes, or even they say, well, why did you not go red lights and sirens? So we're sending mixed messages, and I think we need to be all kind of on the same page. The culture change for the fire service, because of the fire service around the country, just in general, that's a bigger lift. And if we can change that lift across the area, I think that would be a huge benefit to our communities.
Great, thank you. Yeah, that's great.
Any other questions? Those are good questions. Thanks, David.
Okay, thanks, Jeff. Very interesting. Kind of keep us informed. It sounds pretty exciting, actually.
I will.
Thank you. Let's move on to Chair. I don't think Personnel or Finance met, so we'll move on to the review of the accounts payable checks. Are there any questions about any of the checks?
No.
If not, a motion to approve is submitted.
I'll make a motion to approve.
Thank you, JR. Second.
Second.
Thank you, Connie. All in favor, signify by saying aye.
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 Any opposed? If not, the checks are approved as submitted by Chief Anderson. And I guess you had some policy updates. Want to go ahead, Patrick, with the cash controls?
You're muted.
So I'm trying to find my unmute button because everything changed when I stopped sharing my screen. All of a sudden, everything went away. A fairly quick, I think it's actually a fairly painless policy to update for you here. So we have a policy about cash controls. And again, I emailed this, I'll scroll it down a little bit. So the only change I had, the policy previously said, or our current policy says that any check over $5,000 requires 2 signatures. The previous policy actually also said, with the exception of pre-approved, unless the expenditures are pre-approved at the commission level, such as monthly medical insurance and payments. So Michelle went back because we have about 4 checks every month that Kate graciously comes over and stops and signs these. Sometimes they all come in at the same time, sometimes they don't. But there's essentially 4 we pay every month that are greater than 5,000, and we could not find where exactly that those 4 checks were identified. I'm guessing at some point in a previous commission years ago, they were listed as these are the 5 that are, or the 4 that are okay, that don't need 2 signatures on them. We did check with the bank, and essentially with Oak Bank, and they said that is a completely internal control. If a check comes through with 1 signature, they would actually rely on us to look and say that it only had 1 signature and for us to follow up on. So what I would like to do and propose here is that we actually list what those 4 pre-approved checks are, so that someday when Michelle is gone and I am gone and Jeff is gone and the next chief and everybody else is in here and says, I wonder what those 4 checks are that we can approve, and you see them every month and you don't see 2 signatures on them, that there's no question that they needed 2 signatures. So those 4 would be group health, which is our dental. And I put the reason for it in there as well on the off chance that we would get a bill from group health. I don't know why, right? But that wasn't for health and dental. EMC is our property and workers' comp insurance. 3 Rivers is our billing company. And then UW Health, that's the one we pay for our medical director fee. We pay that every quarter. But all 4 of those are over $5,000. If you're comfortable with it, of putting those specifically listing those checks to try to save I mean, we like seeing Kate a couple times a month, right? But then we don't have to call her to come in and sign that second check. So any other check that we write that's over $5,000 that is not those four still would require that second signature. So those CIP purchases, handful of times we get very large automotive repairs. So those would still require that essentially that systems of checks and balances. So that is the only change I made to the policy.
Okay, sounds reasonable to me. Any comments, discussion? Sounds like everybody agrees it's reasonable. Why don't we go ahead and take a vote on it? All in favor of approval of the policy as submitted? Signify saying, well, I guess we need a motion first.
I'll make a motion
Out of
to,
myself. Thank you. Second?
Second.
Okay, all in favor of approval of the revised cash control policy, signify by saying aye.
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 aye,
Anyone opposed? No, the policy as submitted is approved. Thank you. Should make it a little easier for.
Kate, you can always come in and say hi. We still like seeing you.
I'll take you up on that.
Perfect. So this will be another one, Terry, and it will need signatures on, so I'll work on it at some point in the future.
Okay, just send me a little text when you get it and I'll
All right,
stop by walking the dog.
will do.
And then I guess we got some feedback from the local about the policy on sick leave.
Sure. So I believe I had explained this in the email. Let me open it up so you can take a look at it. So as I kind of expressed last month, very grateful for the opportunity to give this sick leave. I think as I even told you last month before we approved it, there was already a handful of people who were out for various reasons or children. Completely missed it off of my radar, but we did have one employee who last fall. So he had one date in October and one date in November where he actually was required to stay home because his children were sent home on quarantine and couldn't go to school. And so between him and his wife, he was required to take 2 days of leave. Again, not on my radar. So when I drafted the MOU here and presented it to you, I only took it back to January 1st. The request from him was to make this retroactive to, it would have been October 1st. And it would cover him for those 48 hours. Said I would absolutely bring it back to this group. It's not like he gets any more after the 1st. We would just change the date to make it retroactive to October 1st, which would cover his 2 days. I did talk with Kyle about whether we had to draft an entire MOU. If you're comfortable with changing that retroactive date, and I don't know the official legality of the comfort of a handshake deal of, right, this video is recorded, it's in the minutes, that you would agree to change that date without having to chase down 4 new signatures. I don't know the legality of it. I don't think it's going to be hugely a contested issue, but I guess I'm throwing that out there for your discussion, whether you want to authorize that to happen and whether you're okay without. Otherwise, it's not a huge deal to just draft an amendment.
Yeah, I'm fine with it. Any other comment? Anybody concerned about it?
I'm fine with it.
Yeah, it sounds fine.
I'm fine with it.
Okay, let's just go with the flow then. Sounds good, Patrick.
Okay. You want to probably go through the motion process just to make it official to change the retroactive date to October 1st.
Okay. So,
So move Lonsdorf.
Second.
Change the date to October 1st.
Second.
and was there a second?
Yep, Shannon.
Okay, thank you. So all in favor of changing the date to October 1st of last year, signify by saying aye.
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 And anybody opposed? If not, we approve the changing the date to October 1st of last year. And any other business anybody has want to bring up?
I just wanted to bring up if you haven't watched the news, Governor Evers passed or proposed $30+ million given to rural EMS agencies. Part of that package included an increase in Medicaid rate reimbursement. So if you care to watch it all tonight at 10 o'clock on channel 27, there's be a little interview about that. It's really pretty huge for EMS agencies around the state that we're finally kind of making it to the top of the list on some of the legislative process. So just letting you know that.
Was it quite a bit of an increase? Any idea how much impact they would have on us?
I believe I sent the email out today that we got from the county, that it included the press release from the governor, and then the emergency management from the county kind of did a quick summary. My interpretation of it is that they took our medical assistance, the biggest impact. Well, we'll see some increase in some VAT funding. I don't know that anybody's aware of how they figure that formula out, but the formula will change, so we'll get an increase in our VAT funding every year. And then the other thing we will see is medical assistance reimbursement. My interpretation of it is that it is now 80% of what Medicare would pay, which is almost double what medical assistance pays now. Yeah, which is
Help them. Yeah.
Yeah, I mean, so from going from $111 to $210 is it's been, we have as we've shared in that annual report. I don't want to say it's significant, but there's a significant amount of our population that is on medical assistance. So we'll actually get, it'll take a while for us to see that and be able to estimate what that is, but we'll see a better return on our patient population who uses medical assistance. Opportunities as well. I think the third component was for grants, for short-term grant projects. And we discussed that today at a EMS chiefs meeting across the county, whether ideas as a county initiative to move forward with some purchases or individual services. If we want to put in some funds, I don't know that all the details have come out there yet, but yeah, you can see Jeff on the news tonight. I sent you the email, and then Chance Kazmarski, one of our paramedics, he sits on the board with the Wisconsin EMS Association meeting, Wisconsin EMS Association, and he was actually up there at the Capitol as part of that presentation by the governor a couple of days ago. And then he was actually up there again, I believe it was today, as part of the, about a year ago, the post-traumatic stress bill that went in front of the state legislature to help sponsor support and payment for post-traumatic stress in EMS. So he and actually Kyle told me this morning he was going up there as well to testify in support of the original bill was only passed for firefighters and police officers and did not include EMS agencies. So it's being reconsidered to include EMS agencies. We all do the same thing. We all see the same stuff, yet we were left out of that original bill. So we did have two entities up there, two of our participants up there to support EMS.
Thank you. Any other business? You want to make a comment about next month, Patrick?
Sure. So for anyone who joined us a little bit late, so I will actually be out of town on the 17th of next month. I'll put Jeff back out there. Jeff has more than graciously agreed to step in on my behalf should it be necessary. But fortunately, is the longer I keep talking, the longer this meeting is. But there's nothing, unless something comes up between now and then, I really don't have anything as well for next month's meeting. We did have our audit. She came in it was a whole team of them came in the first week of February there. Do you remember, Michelle, what kind of that end date was? Usually it's done in March and they present it in April. You're muted. I'm just gonna on Mystery Science 3000. I want to do that, but we can't hear you, Michelle. You're muted.
Sorry. She said that she was working with several other businesses yet this month, and she would probably get back to me early to mid-March with anything else they might need. So my guess is mid to late March we'll hear something.
Okay. So I would propose that at this point in time, we tentatively cancel that March meeting unless something comes up, and we can make sure that it gets called back in so that, but Jeff, just in case, Jeff is prepared to step in and do it.
I'm always here for you, Chief, always.
So in April, if they're done with the audit presentation by April, we'll have the audit presentation in April, as well as we talked about last month, discuss the labor negotiations. So after the elections, to see who's on here, and to you don't have to, I don't know, necessarily bring your ideas to the table, but somewhere in that April or May timeframe, we need to give that letter to the union with the intent to negotiate and identify what that team wants to be in April. So hopefully we can get that process started in May. April, not off the top of my head as well, may need to present to you the CIP budget, because I think that's due in, I don't know if you remember, Shannon, I don't know that I've seen that from Misty yet, when that time frame is, but usually about April is when I'll present you with the capital improvement stuff for next year to be submitted to them by May. As you can, the only things we have on their vehicles, and just like everybody's other vehicle, the last estimate I got from North Central is roughly about a 12% increase in trucks. Yeah. So,
Patrick, I have a question. I've been on the commission for a year, and I think we've only met on Zoom. Or no, we met one time in the Fitchburg city office.
yeah.
When the mask mandate goes away and we presumably meet in person in April, where is it that we meet? I've never met except at Fitchburg.
Sure. Gary, do you want to spearhead that conversation? Or?
I guess it doesn't matter to me. Historically, we kind of met in Verona, but Fitchburg kind of works out kind of nice just because of the communication apparatus is all there.
Yeah. So historically, yeah, go ahead.
I think Scott kind of likes it there too. Of course, that was a meeting where we had it both in person, and I think there was also some of us were still Zooming. So I don't know. Is there a preference where people would prefer to meet if we meet in person? Although, frankly, I think a lot of us like the Zoom meetings too.
Yeah, they're nice. Yeah.
So maybe we could do it both ways. If some are concerned, or I personally not a big fan of driving at night because I have trouble with the lights blinding me on a long drive. But I don't know. Is there a preference for people to soon meet in person in April? I don't know. I think JR had expressed an interest in that, and sounds Dave, you ever be interested in doing that?
I don't mind meeting in person, but we can do a combo too. I mean, makes no difference to me.
Well, maybe we could shoot for a combo meeting. Leave it up to people to decide if they want to meet in person or not. It sounds like the mask mandate's going to be off, what, March 1st. So it still doesn't mean that some of us probably will want to wear a mask when we're inside.
Why don't we tentatively plan on a hybrid type meeting then for April? And I will reach out to Fact TV and see. I know the answer I'm going to get, but I'll reach out to Fact TV and see about a location.
Yeah. I guess I'm good with either one, but okay. So we'll leave it a little bit up in the air on that, but sounds good.
All right.
Any other business? Otherwise, I think we'll be a good time for a motion to adjourn.
I make a motion to adjourn.
Yeah, second.
A second.
Thank you, Connie. All in favor of adjourning?
Aye.
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 Okay, thanks, guys.
Thank you,
Go on.
everybody.
See you all in 2
Have a good
months.
night.
Have a good trip.